I'm Anne-Marie McQueen, Editorial Director of Live Healthy, and I'm here with Bushra Hatahet. She's a qualified midwife with more than 15 years of experience helping women in postnatal, pregnancy, delivery, everything, childbirth, preparing, aftercare, and this is a really cool topic, not one I know very much about, but I'm really excited to have you and ask you some questions.
Thank you so much for having me on here, Anne. It's a pleasure to be here.
Okay, so first of all, how do you get into this line of work?
So I was 17, and you know, in the UK or anywhere now, you do your GCSEs, then you choose your A-levels, and your A-levels is basically what's going to dominate your career, right? Because that's going to choose what you do in university. I had no idea. I did Christian theology and English language, because for me it was like easy. I don't have to study and work and learn maths or anything. It was just all theory and using my brain. And then I applied to do criminology, because again I thought, oh. And then unfortunately my granny fell sick and she was in hospital for quite a long time. So me and my family, we found ourselves sort of like taking over, like spending longer with her in the hospital. And I just found myself sort of naturally very in tune with her physical and nursing needs, as well as her being my granny, and I wanted to look after her, and she was bedbound. She had a chronic condition in her spine, so she couldn't move. I was doing all the nursing needs and basic nursing care, like making sure her hands were always moisturised, dry shampoo in her hair, and just making sure she was eating and drinking. But then I started being like interested in the nurses station and like chatting to them and looking at her charts at the end of her bed, and when the doctors were coming in the room I was like talking, like, you know, just chipping in. And my mum was like, oh, you're really good at this, why don't you do nursing? And I thought, I can't do anything like this for anybody else, you know, I don't want to deal with men, sick people. This is my granny because I love her. And then my eldest sister Iman was pregnant with her first daughter, who's the first grandchild in our house, so we were all super excited. We still are excited for every grandchild. There's 10 now. The 10th one is probably the most exciting than the first one. And I went with her to an antenatal appointment, and I just saw the midwife having a feel of my sister's tummy and listening in with her ears onto her tummy. And I was like, she's like a little witch. She knows where the head is and where the limbs are. And so I went with my sister to her birth experience and her journey for labour, and that was just like the most magical moment ever, just to see what midwives were doing, that they were the boss in that room, and they had my sister's best interest at heart, what she wanted, how she felt from every breath that my sister took during labour. It was a very difficult time for everyone. They were so calm and chilled, and they just knew what to do, and I just had this respect, and that was it. I was hooked.
Wow.
I started reading about childbirth and just trying to understand the role of the midwife, and I just loved the fact that they were so empowering to women. They involved us in her care as we were there in the room, her husband, my mom, and they would just seem so like genuinely as if it was the first time they were having this experience as well. And then I went with a couple of a cousin and my other sister, and the three of them had three different birthing experiences. So that didn't faze me. One had an emergency C-section, one had a delivery where all the doctors were in the room and had to help the baby come out because of an emergency. And my sister's labour, Iman, that was actually quite straightforward. The childbirth, that bit didn't actually bother me, and it didn't faze me. I was just very focused on the care that was given to these patients and my family, and that's what I wanted to do. I wanted to provide a certain standard of care, love, TLC, and reassurance and empowering to patients during this time, because I'm talking about this experience 20 years on. You speak to any woman in the world, if they've had kids, they'll always remember their midwife. They'll always remember that one person that came in the room, and whether it was she smiled or she made eye contact, or you always remember your midwife?
It's so different because I'm from North America and you're from the UK, and the UK is very midwifery is embedded in in the medical system, and it's not at all in North America. Can you just talk to me a little bit about the difference? And then the UK system is reflected here in the UAE.
Yes, it is. So that was one of the prime reasons I came out here to work in the hospital where I was working, because it was all midwife-led with obstetricians, but midwives were the primary caregivers, so it's very similar to working in the NHS. Most hospitals here do have an American system or a North American system where you're cared for by your obstetrician, but when you go into labour, you have a nurse that looks after you, and they give you all that TLC, and they manage and look after your progress in labour. But they're calling their doctor all the time to inform the doctor and keep them updated of what's going on. But that doctor might not physically be present. But they'll call them in if they need to, and they'll call them right at the end for delivery. So the doctors will come in at the end and take the delivery. To me, because I've got a lot of experience, that doesn't really matter anymore, because the care is what counts. Yeah, so even the patients will remember their nurses or their midwives. But the thing is that we do in the UK is, once you're pregnant, you see your GP. Your GP will pass you on to your local midwife, and your midwife will look after you antenatally as well. Okay. So they'll do all your appointments during your pregnancy, take your blood test, do all your screenings that you need to have, measure the growth and the well-being of mum and baby. And unless there's a problem, you'll then see a doctor in your pregnancy. So the difference here is you'll see the doctor throughout your whole pregnancy, and your midwives you'll really see at the time of delivery if you go to a hospital that has midwives for delivery.
And so what does a midwife do that's different than a nurse? What do you do from the beginning?
So my degree it's a Bachelor of Midwifery. So we are essentially the experts in childbirth and labour and the postnatal period. So we do hundreds of things. Where do I begin? Yeah,
exactly.
You know, so just even a check-in on your emotional well-being. How are you getting on? It's not always just about check your blood pressure, check your urine, and do a scan. It's the biggest time of your life. It's the most exciting time, and it's a journey. So when you have a midwife who gets to know you, we can pick up on signs and symptoms. Are you feeling down? Are you okay? Are you getting tired? Let's recheck your iron. You look like you might be anemic. How's your health, your diet? So we do a holistic approach from your mental health, your physical health, from nutrition to guidance and teaching and educating you how you're going to actually deliver your baby, because that's another course or something that you need to be aware of as well. And then after delivery as well. So the thing here in the UAE, the aftercare you don't really get like what you do in the UK. You have your baby, and then you see a neonatal doctor and your obstetrician for yourself a few weeks later for a general checkup. But actually what we do in the UK is we do daily visits. Daily, especially if it's your first. I think it's a little bit different now. I've been here 9 years, so obviously with the strains of the NHS and funding, etc., that's probably been cut down a little bit. But when I was training, you go and see a mum within 24 hours after delivery. You do a day 2 visit, and then you ask her, do you want me to come back in 2 days, 3 days? If she needs you to come back the day after, I'll go and see her the day after. And you do a visit up until 10 days of delivery. Okay. And that's the most important time for these new mums and dads, even second time round. Just because you've done it once, it doesn't mean you know it all. Okay. It could be a very different birthing experience, a different time in your life. And each baby is very different. Just because you may have breastfed one baby for 6 months, this doesn't mean that's going to happen. Or if you didn't breastfeed your first baby, you might want, so there's lots of different things. Is breastfeeding the main issue, or are there other? No, everything. So once you've just given birth, you have gone through a whole roller coaster of events. You're tired, you're exhausted, you're emotional, you're happy, you're sad. There's lots of things that go on. So as well as breastfeeding, which is probably it is the main concern, because right now you have a human being that needs to be fed and watered, and you need to learn how to do that. But baby cares, how do you bath the baby, how do you hold the baby, looking after the cord, because that's, when the cord is cut, that's quite a delicate little area. And the mum, she has bleeding after delivery. We need to check that that's okay and it's normal. if she has any stitches, has she had a cesarean section, she's going to have major abdominal surgery to recover from. So they need help with mobilizing, you know, little hygiene needs, just to encourage and teach. This is what you do. You change your pads every couple of hours, and we've all got little tips and tricks that we have. You know,
you must have them. How many?
Yeah.
So, do you actually deliver the baby?
As a midwife, we deliver the baby.
You really deliver. How many babies have you delivered?
I think my dad would be very annoyed at this answer because he told me from day one, record them. Yeah. Write it down, and we did. So as a student, to qualify, you had to do 40 unassisted birth to qualify. I think I've probably done maybe around 1,000.
Wow. And after delivering all of those babies, what's your take on what people can do to have it go more smoothly?
I always just say, make sure you ask for help, you know what your options are. I say to every parent, do an antenatal course. So I teach a birth class, which is preparation for labour and delivery. So you just have some knowledge about what happens, how do you know what a contraction is? What does it mean when your waters have gone? Because you see on the telly, your waters have gone and you go to hospital, you
have a baby.
Yeah, and it's not always like that. And even if it is, that's not always a good thing as well. Too fast, too traumatic. So I teach a course on how to prepare for labour and delivery. What are your pain relief options? What does an epidural mean? What does it mean when people are on gas and air? What's 5 centimetres? They sent me home because I'm not in labour, but I am. So I teach a little course on that. So I think it's important that mums, parents do that course. Most hospitals offer it. There are centres and studios and midwives that do the course. It's not a course, it's just a teaching, sort of a chat.
And there's different modalities and ways of teaching it.
Yeah.
When you hear midwife, it still seems to be more of an earthy connotation, like, you know, more a natural, if you will. Is that a true perception?
I think so, yeah, because at the end of the day, childbirth is the most natural and normal thing any woman is going to have to do. We've done it for years, that's how we've evolved. I mean, essentially we are, because that's our expertise in normal childbirth, and childbirth is normal. And we do have midwives' intuition as well. Sometimes you get a gut feeling. I always listen to that, you know. Things might be going well on a monitor, and we get very fixated on monitors, especially with this generation and AI and the
apps
way
and tracking.
We are. Yeah, app says I've had a contraction, but you've just talked to me through your contraction. So go back to bed, you know? So it is a lot of hands-on and instinct as well, and experience. In terms of us being like this earthy type thing, I guess we are a little bit, and that's a good thing, but we come with experience and evidence-based. So everything that we do is based on international guidelines, NICE guidelines. We're working with standards and benchmarks, and we use that with evidence-based and our experience and learning as we go along.
A lot of women want to have a natural childbirth and they don't want to have an epidural or any drugs. Is that, how do you navigate that line?
So childbirth is your journey and it's your decision. If you want to have a natural childbirth, that's absolutely fine. I always just say, go with the flow. Don't have a plan set in your mind, because the worst thing is you have this plan and everything doesn't go to plan. And how are you going to deal with that postnatally? Because your emotions are up and down, and I don't want any woman to feel disappointed and upset with herself and then guilty. At the end of the day, you've birthed your child to the best of your ability. It doesn't matter whether you had a normal delivery or a C-section. Like, you've still birthed your baby. So I always say, go with an open mind. I'm all for natural childbirth and no epidurals, that's fine, but sometimes there's a place where we need to intervene and say, look, it's, you know, things are taking a certain toll. Sometimes we need to give you epidurals for medical reasons, even though you might be coping fine. And sometimes people want an epidural, and I'm like, actually, you've come in at 10 centimetres, you've done it all at home. Why don't you just try something else? So I'm all for women's choice, to be honest, what they want to do, as long as they just understand. Because I'm the kind of midwife where, so I've set this business now because I'm an advocate for women. I just want them to make sure that they have choices, they understand their choices, they're happy, they're asking the right questions, and they feel empowered. And at the end of the day, no matter how your you and your baby are at the end of the journey? Were you informed and you understood every single step of that journey? When the doctors came in the room, did you understand what the discussion was? Because a lot of women that I meet and speak to, they always talk about, I didn't understand what happened last time. It was all ablaze. My husband was the one speaking for me outside the room. And that to me is just quite sad that they've delivered this baby and they don't actually know what happened.
Well, I mean, that happens a lot when you go to the doctor.
Yeah.
You think you know what you're doing in the doctor's office, you leave and then you're confused. It happens to me, and I'm like a professional at asking questions and getting information. So when everything is heightened like that, of course you would feel like that.
Yeah, because you're very vulnerable as yourself. Me and myself, I was recently, just going to the doctors for something, and I left and I was like, I can't believe I didn't, So that's why I'm an advocate for that. So I will tell patients, have you asked this? Call me when you finish your appointment. If you want me to attend the appointment with you, I'll attend the appointment with you. And just to always be there to sort of be an extra pair of hands and an overview of things. So I'm not emotionally attached and I can say, right, you think you need to do this, or just so they understand what's going on. Are
there things that are now being backed up in the research that people should be careful of when they're approaching having their first child? I mean, I've been seeing more and more about inductions and some controversy over whether being induced. And I have friends that have been induced and found it to be a very intrusive, upsetting process. And it stayed with them for a while.
Yeah. So there is definitely unnecessary interventions. There are interventions that are necessary as well. So a lot of women get very fearful from the word induction because it is invasive. We're forcing labour on you, so labour is going to be a very different process to if you went into labour naturally. So if they are being offered induction by the doctors, they just need to actually understand why, and they need to be fully informed and aware of it. So if a doctor is telling you, for example, we need to do a diabetes test in your pregnancy, the patient needs to understand there's implications for taking that test if you are then diagnosed with diabetes. It doesn't end there. We've started this ball, very rightly so, for doing the testing. I'm all about doing the testing, but they need to understand then, if you are then found you have diabetes, we then need to monitor you a little bit more. We're going to do extra scans. Oh, in one of the scans, baby's a little bit big. That means we need to monitor. So you see, it turns into a whole cascade of interventions. And if women are offered induction, they just need to understand and have that discussion with the doctors to say, do I need to be induced and what's the reasons for it? And explain the induction process. And the doctors, I would say, and I would tell any parents, when they're choosing their obstetrician, make sure that doctor is following Royal College guidelines, because that's the international benchmarks. What's the reason for induction? Is it because they have a holiday on Friday and they want the baby out for Thursday? That's the reality, so unfortunately, sometimes. Or is it because you're now crossing your due date and you're worried about the movements of baby, so let's be safe and get the baby out earlier? If you have that discussion with any woman, no woman will say no to being induced if they understand why they need to be induced.
Yeah.
It's very, very rare that a woman will say no, because there's a medical reason to be induced. We're worried about you or your baby. And if the mother understands that, of course she'll say yes, but she also needs to understand this is the induction process.
Right. What about cesarean sections? What would you like people to know about cesareans? Because there are still people having cesareans for, I guess, ease of living or not cosmetic reasons, for cosmetic
reasons. It's ease because when you're having the baby and there's no, you can plan it really.
What do you want to say to people about the health of mother and baby? If it's a very tender subject, because if you end up having a cesarean section, you don't want people to feel badly that they had a cesarean. But there's like implications for the gut microbiome of the child, and intravenous antibiotics and all those sorts of things.
At the end of the day, a C-section is major abdominal surgery, so it's not a decision to be taken lightly, because like you said, rightly so, it does have a massive impact on mum, baby, and future pregnancies. Like I said, I'm all about choice. If a mum turns around and says to me, I want a C-section, I'll say that's absolutely fine, as long as you understand A, B, C, D. It's their choice. I'm not going to tell them how to raise this child. It starts from pregnancy. Once they're out the doors, I don't know what they're doing tomorrow. So I'm all about choice, as long as you understand that Yeah, you can have a C-section, fine. It just means it might limit how many babies. If you're looking to have a family of 5 and you're a 22-year-old, I wouldn't advise it. If you have fear of childbirth, you know, there's mental health, you have to look at mental health as well. Fine, I would suggest it if someone has a real trauma over certain aspects of their physical body, then, you know, there is definitely a place for it.
Okay. And what about preparing for the delivery? I mean, I have a friend who did Pilates years ago, and she said that her baby just like flew out, and then they said, "Do you do Pilates?"
Oh, well.
I mean, I think this might be a myth, but she said it actually happened to her. Like,
yeah, see, women like to talk about their experiences, which is fair enough. Yeah. But the problem is, you know, that might have just been a coincidence.
Right.
Has she been doing Pilates for years? Has she got, you know, I've
core strength. Is core strength at all an element in? To be fit,
absolutely.
Okay.
So I do pre and postnatal fitness because I believe you need the strength in labour to be standing for long periods of time. You need to be able to move and be flexible with your hips and certain movements. That definitely has an impact. If the fitter you are, the shorter your labour can be. That's a fact.
Okay.
So if she was doing Pilates, for example, she has endurance and strength, core strength. That's great. It probably did contribute. So I always say, just don't do anything in your pregnancy. If you've never ever done spinning before, why are you going to do it now when you're 12 weeks pregnant? So
I remember a woman in Canada was very angry because she wanted to start doing Bikram yoga, like the hot yoga, and the studio wouldn't let her do it. And they'll let people do it if they've been doing it all along, but they won't let them just start.
But especially with Bikram, because it's in a warm room. Is that the one, the heated?
That's the one that's hot for 90 minutes.
And when you're pregnant, you already,
it's not
your blood pressure's already on the lower side. So
when you're fit like that, does it help with your recovery?
Absolutely.
Right.
Yeah, helps with your mobility, recovery, just, getting back on your feet. So I do encourage people to just stay fit, if they were, because a lot of people who are fit and train then fear as well and say, oh, my doctor told me to stop and start again, at 16 weeks. I say, for me, carry on. Listen to your body. If you've been doing this your whole life, continue. If you've never done, if you've never picked up a dumbbell before, you're not going to start it now when you're pregnant.
Right.
So and if you want to do something new in your pregnancy, there are things we can do. There is walking, there is incline walks, there's slow and steady mobility exercises and movements we can do with Pilates balls and that kind of movements.
Do you have any sort of words for postpartum depression and how to mitigate it, or do you see any commonalities in women who experience it?
Yeah, I think the good thing about, as a midwife, you get to see that woman's journey from pregnancy to delivery to afterbirth, so we can see the changes in that patient or the client. It's very normal to feel very teary after delivery. We say the milk comes in and the tears come out. And you might have heard of baby blues. So you've gone through this whole roller coaster of events and you're holding this newborn and you're just crying and you're just wondering, why am I crying? I'm supposed to be happy. It could be tears of joy, it could just be you just feeling very emotional, and that's normal. But it's very important, and that's why we do the postnatal checks as midwives back in the UK, and I'm trying to advocate for that here, to recognise postnatal depression, because the blues can turn into something a little bit more significant. I would say, I might be not correct 100% on the statistics, but let's say 60-70%, for example, of postnatal depression, the depression probably started antenatally. So there was already cues there beforehand. There was already some worries, some anxieties, some living situations, something already there pre-existing.
Really?
That's heightened in the pregnancy, and now after delivery, it's just gone off. So I would say most of the women I've met with postnatal depression, they had something going on beforehand.
Before even they got pregnant?
Yeah.
Interesting.
Yeah.
Okay, very interesting.
Or if not before pregnancy, it was triggered or just switched on during the pregnancy.
Got you.
Just like you get antenatal depression, is equally just as important to recognise as postnatal depression.
How about breastfeeding? Is it common here for people to breastfeed?
Yeah, I mean, as soon as we deliver the baby, we always encourage skin to skin, and that's for bonding for mum and baby, and also plays a massive impact to try and help you with your letdown and to get your breast milk to come in. It's very common here. even in the UK where I trained, I'd say pretty much everyone attempted to breastfeed at delivery. But again, it's your choice. If you have said, no, I've got my bottles ready, I know the research, I know breast is best, but I'm going back to work in 2 months' time, which a lot of women do here. So, you know, the maternity leave is much shorter. But obviously we advocate for pumping and teaching how to, you know, get the breast milk into the baby. But it is very common, yeah, and that's probably the number one thing that a lot of women have challenges with after delivery. So I do a course on antenatal hand expression. It's my little top tip trick. Learn how to look at your breasts before you deliver, right? Because these are your tools to look after your baby. Look at them, examine them, see if there's any challenges. If you've got inverted nipples, flat nipples, there are things you can do to correct them, to get them ready for delivery and to feed your baby. Learn how to express the milk. You start producing milk from 16 weeks of pregnancy. So you can start to express the milk and get colostrum from around 35, 36 weeks. You just start massaging the breasts and just get the milk out. Put them into little syringes, pop them in the freezer and bring them in with you when you're in the hospital.
Wow.
And that helps. So if you're exhausted after delivery, or there's a separation between mum and baby for whatever reason, then the baby's got something to feed, some breast milk that we've brought with us, our thawed little breast milk. And it also helps you prepare your body for labour and gets you into labour.
That's amazing.
That's a little trick. Yeah.
And then you also would have some confidence. That
exactly, because then you know if you can't latch your baby on, you have an angry baby that's trying to feed, then you can just calm your baby down, try and squeeze a little bit, do your manual expression, get some out first, and then you can entice them with those little drops, which will calm them and get them to latch and feed better.
Wow, that is just wonderful.
It's one of my favourite things to teach around 36 weeks.
Okay, how do you know you're going to be able to make every delivery when you sign up for it? You just have to live your life?
So I take on one every 6 weeks.
Okay.
So at the moment with the work that I'm doing, I'm advocating, so I'm a birth partner.
Okay.
So I'm not doing hands-on deliveries anymore because, like I said, for me the most important thing is being there for the woman. So if a woman's in labour and she thinks she's in labour, I'll go to a house and be her birth companion, and then we'll go to the hospital together. The midwife can do all the clinical bits and bobs and the doctors, but I will just be with her the whole time.
Okay.
So I take on one every 6 weeks.
Okay.
Yeah, so I can make sure I'm there for that. I don't take on more than 2 a month.
And I've only been at one delivery that I covered on the side of the road once. And it was
I've not even done that.
Thing. Yeah, amazing. It was the firefighters delivered the baby, and I was the reporter there. But it just makes me happy even just thinking about it. So you get to see all this joy. Like, what is one? Do you have a favorite story or a thing that you just every time you say wow about life? Or
I genuinely, hand on heart, say wow to every single delivery. And I think the older I get, the worse it gets. Get more emotional. Yeah. Honestly, I know it sounds cliche, but it really is a miracle. Yeah. Like every single time, and that's part of empowering women and parents. And I say to them, oh my God, look, your baby was just inside. Wasn't that the little elbow you were telling me about over here on this side that was kicking you?
It's crazy. It's actually shocking when you think about what a woman can do, and the fact that it grows from this
little bean to it is amazing.
So you're still surprised by it?
Always, honestly. It's like it's my first delivery.
It's beautiful.
Honestly. But favorite deliveries? I mean, I have many stories. Yeah. We could be here till tomorrow. I should write them down.
Yes, you should.
I'll do a podcast about it.
You should do a podcast
Bushra's
about
birth
it for sure.
stories. Yeah.
Yeah, Bushra's birth stories. Okay, well, listen, thank you very much for walking it through. And that was a great tip about the pre. I just never even knew.
Yeah. Hand expression.
You do wonderful work. Thank you.
Thank you very much for having me.